Kenyans want Health CS Aden Duale to resign immediately. This follows a shocking expose whereby it is being revealed that the Ministry of Health, in cooperation with the SHA, is sending money to hospitals and dispensaries that doesn't exist. If you go through the social media right now, there is this lady by the name Shola Ad. Since yesterday, he has been digging in, finding out the kind of money being sent to these hospitals in different parts of this country. For there is a lot that if you go through it, you will learn that indeed SHA was created to siphon taxpayers' money, and these cartels looks like they are so determined to steal more than we can imagine. She has been trying to expose people who are involved in this looting spree. She made this post yesterday saying that arrest Aden Duale now, disband the Ministry of Health now. They have registered many fake hospitals as early as this year that doesn't exist, that are receiving SHA monies, stealing. Arrest Aden Duale now, arrest Aden Duale now. And the cry is now being amplified on social media, with many Kenyans coming out to say that it is time for Aden Duale to resign and being arrested immediately. So if you go through this account, Shola Ad, you realize this is what has been happening under the leadership of Dr. Abdi Mohammed, who is the head of SHA, and SHA CEO, of course, Mercy. So this is what is happening. So let me take you step by step on what she has been revealing. Let me start with this one. Tunaibiwa, as I promised, while digging into SHA Taifa Care records, I came across a hospital named Las Ano Healthcare Limited. It received 6 million Kenyan shillings in June from SHA. I tried locating it, and according to the Ministry of Health records, it is shown on the map below, less than 300 meters from the Ethiopia border. But when I sent someone over there, they found nothing. It is just a thicket. According to Ministry of Health records, it is listed as a nursing home with over 34 beds and classified as a level 3, but in reality, it doesn't exist. Strangely, it received more money than many sub-county hospitals. Worse still, the so-called hospitals has no contact details or traceable presence. Even more suspicious, in April, it got less than 5,000 Kenyan shillings from SHA. In May, it got over 1 million Kenyan shillings. In June, it got over 6 million Kenyan shillings. How is that possible? I'm posting the SHA data in the thread now. So this is one of the hospitals that received money from SHA, and this hospital does not exist. And then you go again on one of our tweets. It reads, Tunaibiwa again. I have just uncovered what appears to be another ghost hospital in Mandera that was paid over 8 million by SHA Taifa Care in June. Its name is Ayale Medicare and Nursing Home. For some reason, it didn't receive the payments in April or May, only in June. No payments were made in July or August. The hospital has no pictures or digital trail. According to Ministry of Health, it's supposedly located next to Red Cross, but locals confirm it does not exist. Funny thing is, it's listed as a level 3 hospital, yet received money more than Mandera County Hospital and over half of the other county hospitals. It even received more funds than some busy hospital in Nairobi. Another red flag. The hospital was registered on 3rd March and approved the very next day, 4th March 2022, just before the elections. This strongly suggests there was already a plan to loot using SHA. On the map you see in the picture, that is where it is said to be, but locals say it does not exist. And even if it did exist, there is no way a level 3 hospital in Mandera in 2025 will be taking in 8 million Kenyan shillings in a month, yet it has no theatre and has less than 50 beds etc. Tunaibiwa, I guess now you understand why Duale says what he says. That is the second one. Then the third one, breaking. According to SHA records I've gone through, this so-called nursing home in Modogashe, the one with the blue color, received 6.8 million Kenyan shillings from SHA in June. It is called Modogashe Nursing Home. The nursing home only occupies that single room. The rest are shops and resident property. It is located on the road. Ministry of Health records claim it has 20 beds and a maternity wing. Reality, the black gate you see is just a residential store, not even a level 3 facility. Guys, we are being robbed. Shan Wheezy, spread this message to everyone. Let everyone know we are being robbed. That is the third hospital. And then you go again. She has kept on exposing and digging in to give you more details on how the cartels are ruining everything, including this new health system, and stealing everything. And here we have another one. And her tweet reads, I've just uncovered another one, guys, tunaibiwa. According to SHA records, this so-called hospital in Mandera Elwak by the name Belgorod Medicare received 7 payments totaling 2.836 million Kenyan shillings in April alone. That is just 1 month. The payments were as follows: 13,440 shillings, 15,000 shillings, 98,000 shillings, 297,000 shillings, then 551,000 shillings, then 176,000 shillings, then 855,000 shillings, and another 855,000 shillings, all in the same month. Remember, this hospital has no wards, no beds, according to Ministry of Health. Then in May, it received 913,000 Kenyan shillings. In July, it received 287,000 Kenyan shillings. But look at the image of what this hospital actually is. Just one small room. They, in short, got more money than some sub-county hospitals in Nairobi. By the way, according to Ministry of Health, this single room is classified as a level 3 hospital. What's more shocking, I'm told the owner was a doctor, nurse in a nearby facility, and they hurriedly opened this in January. Ministry of Health records show even worse. The application for registration was made in January and it was cleared the same day. It has been posting more evidence shortly, or I'll be posting more evidence shortly. I'm a bit exhausted. I've been combing through this data since morning. Spread the message. That is, let us look the last one. Tunaibiwa. According to the records, they paid the Derkhale Medical and Diagnostic Center Limited over 3.6 million. But if you search for this hospital on the Ministry of Health database, it doesn't exist. Not digitally, not physically. I even came across a copy of their so-called license. When you search that license number in the database, it doesn't exist. You can check this yourself. To make matters worse, the facility was registered in January this year and listed as a level 3 hospital. Now, here is where it is getting interesting. If you search for Derkhale dispensary in the Ministry of Health database, you will find a facility registered back in 2016 as a level 2 dispensary. And by the way, it also doesn't exist. And in April, the dispensary received over 400,000 Kenyan shillings from SHA, free money, which clearly means this is a completely different hospital, if at all it did exist. I even sent someone to the location of the so-called dispensary around the Kub Mosque, and I can tell you with certainty we are being robbed. These guys are looting public funds in broad daylight, Yesterday, I came across a very similar case that I will share. Shah is making a few millionaires. Aden Duale must go. I am attaching details in the thread below. And she indeed has attached these details. You can see here how the money was being transferred to this hospital, and in a hospital or a dispensary that doesn't exist. So looks like this has been happening. And before all this was being exposed, there is one facility that was exposed. It was in Homa Bay. I think its name is Nyandiwa, whereby it was discovered that this facility received 19 million Kenyan shillings, and it does not exist. It was not even officially opened. Like the building is there, but it has not been receiving patients since I think since it was built or put up. So this is the kind of money looting spree that Kenyans are experiencing, or Kenyans are just discovering with Shah. And remember that 2 days ago, Aden Duale rejected when it came out that this Nyandiwa dispensary in Homa Bay County received 19 million Kenyan shillings. Aden Duale, through Social Health Authority CEO Masi Mwangangi, recently claimed that the hospital has been operational since 1970s. But indeed, the NTV did a story yesterday, and it was discovered that this facility has not been operational. So, in short, that these people have found a new way of stealing public money, and this time round they are doing it with Shah, sending money to non-existing hospitals. This is tragic, this is tragedy, this is horrible. And we are being led by people whose soul are dead or something like that. So this Shola ad continues to expose this. I will be checking back later to give you more details of this story, but this is really sad that we are being led by thieves who don't even care any money to them. They want to steal as much as they can, but this must be stopped. So Kenyans on social media are calling out for Aden Duale resignation, and they want him, once he resign, they say that he should be arrested. So that is it from me for now. Thanks for watching, and this is Sophia Live.